Basically, is a misnomer. Prostate health is a misnomer. What you do is you do a blood test to assess how the prostate is functioning, which is called PSA, which is a short form for prostate-specific antigen. With prostatic health, it's a collective testing. You look at PSA, you look at other blood tests for renal parameters, and also you do a flow test to see how the person is passing urine, especially if they are symptomatic. Of all these tests, the PSA gives you the clue of whether the prostate is benign or cancerous. According to the current evidence, there is a Scandinavian study which has shown that it is best to check the PSA at 40. If the PSA at 40 is normal, which is 1.7 or under, then you recheck at 50. If it is normal, then unless you become symptomatic, then you don't need to get it checked. But if it is abnormal, or if you have got a family history, you're from the Afro-Caribbean descent, then you probably need it checked more frequently. Quite a lot of the time, prostate don't become symptomatic, especially prostate cancer is diagnosed with a blood test and a rectal exam these days. But the common symptoms are urinary symptoms. When you notice changes in your urinary habits, like you're going more frequently to the toilet, daytime or nighttime. There is sudden evidence of urgency. Sometimes there is blood in the urine. Sometimes there is blood in the semen. And these are just heralding signs of something is wrong with the prostate. It all depends on whether it is benign or you're looking at cancer. If your PSA is high, you would get an MRI scan and then proceed to get a prostate biopsy for the diagnosis of prostate cancer. While on the benign pathway, again, PSA is important. That will give you a clue of whether your symptoms will deteriorate much quicker than a normal person. And then you would assess the prostate with a rectal exam on both occasions. And then in the benign setup, you would do a flow study and also what is known as an International Prostate Symptom Score, or an IPSS score, which gives you a guide to help with management. And metabolic syndrome and prostate problems go hand in hand. So if you're a diabetic, get your sugar levels under control. If you're obese, try to lose weight. And if you're hypertensive, get that. Obesity and metabolic syndrome are quite important markers that would suggest that your prostatic health can deteriorate. So it's important that you look after yourself.